Good morning, Singapore. Welcome to Happy at Work. No, sorry. Welcome to Therapy Tuesday, right here on The Big Show and The Big Show TV. As always, we have from the therapy room award-winning psychologist Dr. Geraldine Tan, and she is on location today. Tell us where you're at and who is this fine young gentleman seated next to you.
So exciting, right? So I am at NNI, the National Neuroscience Institute, yes. And I have with me Prof. Tan.
Okay.
So last week we were talking about chronic illnesses, we were talking about multiple sclerosis, and we had Shannon and Michael with us, and he is their doctor, so he has brought back hope into their lives. So he's going to bring hope to all of us.
Wonderful.
Nice. So when you say he's going to bring hope, can you elaborate?
So he does all the fine work here at not all, but a lot of fine work here at NNI, and he deals with a lot of chronic illnesses, including MS. So maybe Prof can share with us a little bit about the chronic illnesses that you deal with.
Okay. Hi. Morning, everyone.
Morning.
So I work at the NNI, and we deal with all conditions related to the brain, the spinal cord, and the muscle as well. Some conditions you might be familiar with would be stroke, Parkinson's disease, dementia, but there are also rarer conditions that we see, such as MS. Other conditions you might have heard about on the news would be conditions like motor neuron disease.
Okay, Prof. Tan, Dr. Jerry just now said you bring fun to the patients. How exactly is this? What exactly do you do?
Hope.
Oh, no, earlier you said that he does the fun stuff.
Yeah, he does fun stuff also. So later on, we'll have a little bit of activities that he will show us that he does with them. But I suppose he also does all the other screening. He does the work with them. So he guides them through. That's how he gives a lot of hope also. So I thought we want to find out a little bit more about how he actually helps them, and also how he works with the mental health part of things. Because last week we were talking about I gave the figures, 1/3 have depression. So I'm not sure whether in Singapore it's the same or not.
Yeah.
That number?
Before I answer the question, I just want to say that we have a whole team here working together, taking care of our patients. So it's not just me alone. So big shout out to our other doctors and nurses as well. So your question about
So what are the numbers like in Singapore? With regards to mental health and the chronic illnesses.
right.
Okay, hold on, Prof. Prof, hold on. Let's talk about this a little bit more on the Big Show TV. Okay,
So we
let's
are on the Big Show
address the
TV
numbers.
now. Yes. So the numbers that we have in Singapore.
Well, I don't think I can give you exact figures for Singapore, but I think in general, people talk about a third of people with chronic illnesses that have depression. I think the numbers are probably about there. Yeah.
But you mentioned that there's this research done.
Yes.
Yeah.
So
Could you share a little bit more about the research?
yeah. So recently, our team published a paper where we looked at patients with MS and other similar conditions. And what we did was we looked back at the period before they were diagnosed with their illness to see if any of them had depression or mental health issues.
Pre-morbid.
Yes, before diagnosis.
Okay.
And it turns out that amongst the people with MS, about 5% already have some form of mental health issues before they were formally diagnosed.
Right. So there's a pre-morbidity of the pre-existing psychiatric condition.
Yeah. Well, we don't know the answer to that at this point. Sometimes it could be because they already had MS, and we know that MS is associated with depression,
Right.
but they may not have been diagnosed, either because their symptoms were not recognized or they hadn't had manifested the usual symptoms that MS patients had.
I see. Okay, okay.
So would it be accurate to say that the majority of MS patients have some form of depression going on?
I wouldn't go as far as to say majority, right? Because that would mean more than 50%, but I don't think the figures are quite that high. It's high enough though that we need to recognize it early. So we can't just sort of treat the MS and ignore the mental health or anxiety or depression.
So
Right.
how exactly is the patient's mental health being screened then?
Okay, great question. So we do this on a regular basis. So our clinic is run together with other doctors and nurses, and our nurses are the ones who help with the screening. In fact, when patients come to our clinic, they will see the nurse first and go through a battery of assessments. And one of the tests that we do is a questionnaire that screens for depression. It's called PHQ-9. You might have heard of it. It's quite a common screening tool that a lot of clinics use.
Okay. So what is the definition then of depression? Because I mean, how do you do tests on an individual and come up with the conclusion that this person is suffering from sign
I think this question, Jerry, would be better
Jerry?
able to
That's
answer.
Jerry's
Yeah,
question.
so they would have a series of signs and symptoms that the doctors will have to tick off. So there's a list, and it needs to be for more than 6 months. So it needs to be
Right.
prolonged. Yeah, so it's present, and the doctor identifies that it has been present for a certain period of time, and then it gets classified or it gets diagnosed as depression.
I see. Okay, because the term is used so loosely.
Loosely these days.
Yeah.
You
People
know,
are like, oh,
I have 3 games of golf and I don't do well. I
I'm
feel
so
depressed.
Yeah.
I tell people like, I'm kind of depressed. So that's wrong. You see?
You're
is.
probably
That's why.
feeling down. You're not quite
Down.
depressed.
That's right.
Yeah.
But does that mean that everyone who comes to you with a chronic illness is screened?
Well, in our clinic, where we see MS patients exclusively and other similar conditions, we do that screening. I would say in our NNI clinics as a whole, because we have many clinics that deal with multiple conditions, there was a project our nurses started called, it's a different tool, they call it a distress thermometer, and it's basically like a scale where patients indicate how they're feeling that day, and they use that to then identify if the number was above a certain number, that there might be something this patient is feeling, and then our nurses will go on and do a deeper dive.
So, Professor Tan, you said that your clinic handles MS patients exclusively and other similar conditions. What are the similar conditions that are related to that?
Yeah, so I work in a field called neuroimmunology. Basically, that's conditions where the immune system affects the brain and other related structures. So MS would be one of the conditions that belong to that group, but you can imagine that, with the immune system, there are other conditions collectively known as autoimmune diseases,
Oh, right.
where our immune system, for some reason, starts to attack our own body. So there's a long list of names of different kinds of autoimmune conditions, which I shan't go through.
Okay, thank you. Thank you for that explanation.
Okay, stand by. We're going for a traffic update and then back on air.
So, Prof. Tan, question. Does this mean, listening to what you're saying, does this mean that NNI is like a one-stop? You would treat MS as well as the comorbidities?
So, good question. I think where it comes to MS, we would be the main treatment point. But if our patients had depression, I think it depends on how severe that depression was. Because to properly treat depression, you will need someone specialized in this, such as a psychiatrist. NNI, we don't employ psychiatrists, but we do work with our psychiatric colleagues from other hospitals. So we are happy, and we do treat our patients who have mild depression, and we're allowed to prescribe medication. But when it comes to more severe cases that are complicated, we will refer to our psychiatric colleagues.
Okay.
Yeah, some people are depressed, but they don't feel like they're suffering from depression. You know what I mean? They get depressed. Yesterday in the news, Lewis Hamilton
Yes.
admitted that he's been, suffering from mental, not mental illness, but he's been depressed for years and years.
Well,
Actually-
you can imagine, because there's so much pressure on them to perform so well, and they're in the public eye. Everything that they're doing is scrutinized.
Yeah.
They can't just walk out and go to the shops and not be harassed.
Yeah.
So it must be quite difficult.
But it just goes to show that even someone who's depressed, who's been suffering from depression for many, many years, can still function.
May not
Jerry?
show it. Yeah.
Yeah, so that's the whole idea, to bring light to different sort of illnesses, right? And also mental health. So a lot of people think that, mental health, once you get it, it's very paralyzing, it's debilitating, you cannot function anymore, but that's not true. So last week we had Shannon and we had Michael coming on. Michael just touched down last night from his business trip, so they're all functioning very, very well, with a team that is helping them. And we need to know that, the medical condition needs to be treated. The mental health condition also needs to be treated for someone to function well. So here at NNI, they have the holistic approach where the whole team works with them. And I was just looking at some of the tools that they have. So PHQ, earlier we talked about the screening test, is patient health questionnaire. So they have the screen with them. I think the nurses will do it.
That's
You
right.
said the nurses do
Well,
it.
the patients can fill in the questionnaire themselves.
Right. So it's a simple, 9 questions sort of screener, very, very fast. There are also other screeners pertaining to the each of the chronic illnesses. So I think one of the scale would be the fatigue severity scale.
Yes.
Yeah.
So besides depression, MS patients also suffer from fatigue. Again, it's one of those terms where we use loosely, and any of us can feel tired, right?
Yes.
But in patients or people with MS, they are more tired than others, and sometimes this is something we don't always ask about, and so we use a scale to identify which are the patients who are particularly fatigued. We can then treat them in various ways.
All right. Let's continue to talk to Prof. Tan as well as Dr. Jerry on The Big Show TV.
The nurses get them to fill this form or ask them these questions, and there is a diagnosis that is done, sort of. What happens, and does this ever happen, where the patient actually rejects that diagnosis and goes, "No, I'm not depressed"? Then
So the
what
reason
happens?
why the nurses can do it is because it is a screener. They're not giving diagnosis. So they just do what we know in A&E as a triage, to see the needs of the patient. So if, let's say, the patient is being flagged out as a little bit more severe, then they will highlight it to the doctor, and the doctor will say, okay, I think there's reason to think that this patient needs a little bit more care, and then to refer on to a different colleague or to another professional.
Okay.
That's how it's been done.
Okay.
Yeah,
Right.
absolutely. I think the diagnosis of depression, and I think here what we're referring to is clinical depression, right? So this is where there's a formal diagnosis, formal diagnostic criteria, and these are patients who may require medications. So we help to do that first cut to identify patients who have depression. Whether they have clinical depression or not will require additional assessment.
Yeah.
Okay.
So when you say someone's clinically depressed, does it mean they feel suicidal?
Not always. So that's only one of the symptom of depression. But it could be other things. It could be fatigue. That's why they need to do all this different screening, because depression also has lethargy for some of the patients with depression. But you have your chronic illnesses, MS, also having fatigue. So sometimes it's a very fine line between the two different medical condition as well as a psychiatric condition. So that's why we need the team to come in to ensure that we don't miss anything.
We want to say good morning to Michael and Shannon from last week. They're both watching us on YouTube. Good morning,
Morning, guys.
Thanks for joining us.
Who's Mike and Shannon?
They came in last
came in
week.
last
and
week.
spoke about
Oh, that Mike and Shannon. Good morning,
this
Mike and
memory,
Shannon.
This memory
Hello.
of yours. Okay, Professor Tan, can you speak about some of the exercises that MS patients do?
Well, so I guess depends on what you mean by exercises. We do certain activities that help us to identify function, right? So these are functional tests, and Jerry just sort of brought something out that we do. So this is called a 9-hole peg test, and it's a assessment of hand dexterity. So if you can see, there are 9 holes here, and we have these pegs, so they're a bit like a toy. And what we ask our patients to do is to place the pegs into the holes, and we time them.
All right.
And then once they finish placing the pegs, they have to remove the pegs as well. So you can imagine if you have difficulty with fine motor movements, this might be, you will take longer.
Yeah.
And then that will give us an idea of how good their hand dexterity is, which in turn would be maybe caused by their MS.
Right.
Is there a certain time limit that they have to do it under, or it's just based on case by case?
There might be, but you can imagine that this would be affected by whether you're right or left-handed. So if your dominant hand, you probably do a bit faster. Might be affected by age. If you were older, you had arthritis, that might take you longer. So I guess the short answer is there might be a range of normality. We won't say that's an actual number that's normal.
Take it to the next level. Get them to use chopsticks.
Glenn,
Yeah.
What?
chopsticks? I don't know. There's chopsticks.
So
You mean
wouldn't
to
that
pick
be
stuff
an
up? Fun one.
No, but wouldn't that be something to test them with, their dexterity with chopsticks?
chopsticks
You can still put it in the holes.
to pick stuff up?
No, I'm not kidding. It's a serious question.
You could increase the difficulty, but we also want to make sure that these tests are standardized, right? So that you can use it in any clinic in any part of the world.
Okay.
Okay. We have a question on our Facebook page from Joanne Coe. Good morning, Professor Tan and Dr. Jerry. I'm an MS patient of Professor Tan. It is important.
Wow.
Yes, it is important to stay mentally and physically occupied. Can you explain that, Professor?
Well, MS, even most people think of as a neurological condition. And I think a lot of the time patients as well as healthcare professionals focus on the physical side of things. So difficulty with motor function, with sensory function, they get numbness, tingling. Sometimes they might have balance issues. But as we've been talking about today and previous interviews, there's a big factor of mental health that can affect not just MS patients but anyone with chronic illnesses. And if we don't talk about it, we don't identify it, and in certain cases don't treat it, patients can be severely affected by mental health. So yes, I agree with Joanne that we need to focus on both the physical and the mental side of things.
Okay. Stand by. We're going back on air for a traffic update and then back on the radio.
Professor Tan, is there anywhere in Singapore, I know we can Google it, I'm not the biggest truster of Google, is there anywhere Singapore-based where we can go to discover more about things like MS?
Yeah. Well, I guess the short answer is yes, but it depends on how much detail you're looking for. NNI ourselves, we have on our website some patient information or patient education materials. So if you go to the NNI website and you look through the tabs, you should be able to find it. But if you want more detail, for very technical stuff, there are, I would say, pretty good websites that are developed by other MS societies, right, in other countries.
Okay.
The one that I've used or recommended to patients quite a bit would be the US-based one. I think they're called the National MS Society, NMSS.
NMSS.
But some of it can get quite technical because they talk about treatments, the trials, and what's going on, amongst other things. I think they do also have articles on mental health, so it's a more holistic kind of a website.
So, Professor Tan, speaking of mental health, earlier Joanne came on our Facebook and asked you that stated that statement about staying mentally active. For those that are listening to us right now, if somebody is, say, a patient of MS, what can they do at home on their own to stay mentally active?
Well, MS affects everyone differently, and there's a whole spectrum. We have some patients who, on the surface, you wouldn't even know they have MS, right? Because they are well, they've recovered from their relapses, they go to work and they function normally. Some are physically active and high functioning. We know of patients who run marathons.
Yep.
Yeah. So I think what we tell our patients is, even though you have this diagnosis, even though we have to tell you this bad news, we want to help you get back to as normal a lifestyle as possible. So whatever they've been doing before, we help them by treating the illness. So one important thing to do is early diagnosis, early treatment. If you get the condition under control, they are able to do pretty much whatever they want to. However, we also have patients on the other end of the spectrum where they are more severely affected. And sometimes the neurological disability may be irreversible. We then explore with these patients what would they like to do, because there will be limitations. I think we can't run away from that, but we will then try and figure out how do we support these patients better in spite of the disabilities.
Professor Tan, I found out last week from Mike and Shannon that medication is extremely expensive. Why is the medication so expensive?
Okay, I think this is a sensitive topic. There are multiple factors. I guess the first point is that a lot of these medications that are developed by pharmaceutical companies, there's a lot of investment put into these medications. And so for pharmaceutical companies to be able to continue doing that, develop new medicine, they have to cover their costs, right? So that's one reason why a lot of medications, usually new medications, are expensive. But on top of that, there's the healthcare system. So different healthcare systems pay for these medications differently. And in Singapore, in general, we have medications that are subsidized and those that are not. And even for subsidized medicines, there are those where they're on what we call a standard list, where it's highly subsidized. We have some that are partially subsidized, and then we have those that are not subsidized. So in MS treatments, you can check this out. 2 of the medications are partially subsidized, but the rest are unsubsidized, and that's why they are expensive.
All right. Okay, let's continue to talk to Professor Tan and Dr. Jerry on the Big Show TV.
Professor Tan, Dr. Jerry has spoken to us about, because you spoke about support earlier, about what families can do from a psychological perspective for patients suffering from MS. From a medical perspective, what can families do?
Well, I think you can, whatever support families give, it's going to be holistic, right? It's not just going to be for the mental aspect of things. I mean, physically, some patients may need help, and if the families are able to contribute as a caregiver, they can provide practical help. I think being diagnosed with a chronic illness is a complex issue, right? Different patients accept this at different times. Sometimes they have to go through a process of denial, process of grieving. I think what families can do during that process is to be there for these patients. Sometimes when they are in denial, they may not accept all the advice that we give. But if the families are with them and they know these facts, they can help to reinforce that there are ways we can help these patients.
Okay.
I guess from last week we were talking about a lot of grieving also, right? Because it's not only the patients themselves that obtain that diagnosis, but also the family going through it together. So I think what I'm hearing from Prof. Tan is you would take time to speak with the families, explain to them about the symptoms, explain to them about what to expect, to give them certainty in the space of uncertainty. I think that's very important also. Yeah.
Often when patients come to the clinic, they won't come on their own, right? They will have family members with them. And so during the consultation, we speak to them as a group.
You know, Professor Tan, sorry, Dr. Jerry, carry on.
No worries, go on.
You were talking about people having support and coming to the clinics and, often coming with family. But I'm sure there are some cases where people might be alone and going through this together. Is there some sort of support group or community in Singapore that people who are on their own can turn to?
Yeah, so short answer is yes. I think last week this was mentioned. So there has been a support group in Singapore for MS patients for I think a good 20 years now. So this is called MS Care, and they have been providing support for patients all these years. There's practical support for those who have mobility issues. The volunteers do visit them at home. They need help buying groceries. They have done that. They have organized social events to try and bring patients and family members and caregivers together. I think a recent one that we went on was to Gardens by the Bay.
Oh,
Wow. Okay.
Yeah.
That's
But
nice.
there's also MSSS, which is the society that was recently set up. I think there's difference between the two groups is that the MS Care tries to provide more, direct practical support, whereas MSSS do more of the advocacy and the education. Yeah.
Professor Prashant is asking, the development and progression of MS, can you explain the genetics behind that?
Well,
The genetic
that's a
connection?
tough one. Yeah. But it's quite a common question that we get asked. I would say MS is not known to be a genetic condition as it is understood in the traditional sense of the word. So a genetic condition, it usually refers to conditions where a single gene would harbor an abnormality, which if a person inherited this from their parents, they would then get the illness. Now it's a lot more complicated than that because it depends on how this gene is inherited. But for MS, what we would say is that it's more of a combination of genes that if a person inherited that bad combination, increases the chances of them developing MS. Now it gets even more complex because we now know that genes is not all there is. There are environmental factors as well. And so in MS, you need a combination of both. A specific genetic makeup that increases the risk, but also some other environmental factors that if you encounter it as an individual, might then trigger off the illness.
Okay. So, Professor Tan, you showed us that little exercise earlier with the pegs going into the holes, and then FD was like, why don't you use chopsticks? Michael actually jumped on our YouTube and said that exercise is already very difficult for them to do.
Okay.
But are there other exercises like hand-eye coordination that you do in the office or encourage these MS patients to do outside of the office, like at home?
Well, the 9-hole peg test that you saw is one of the tools that we use to assess function.
Okay.
There is a set of 3 items that we use quite regularly in our clinic to monitor function. It's collectively known as the Multiple Sclerosis Functional Composite, MSFC. And the 3 components would be the 9-hole peg for the hands, the upper limbs. We do a walking test as well, and it's called a 25-foot walk. And it's basically a set distance, 25 foot or 8 meters, and we time our patients how long it takes for them to cover the distance. And then the final component would be a cognitive test, which is it's called it's SDMT, and I can't remember what it stands for, but it's symbol modality. MDST. Just remember that. And this is an example. And basically, what we do is there are symbols attached to each number, and we get the patients to then fill in what the numbers are depending on the symbol. This is a cognitive test.
Okay. Cognitive test.
Yeah.
Okay. Speaking of all these tests, I just want to ask you, is Mahjong really good for the brain?
Hey, they say it is.
Yes, I would say so.
It is, right?
Yeah. Sudoku, games like Sudoku, Mahjong, all
Sudoku
apparently.
is not so cool. Mahjong is cool. Everybody plays Mahjong.
Do you
I
play
want to
Mahjong?
learn how to play Mahjong.
So you don't play
My
Mahjong?
mom knows how to play
I
Mahjong.
don't know
Wanted
how
to
to play
teach
it.
me once. I said, nah, not interested. But
Now
now
you
I
wanna
think
learn.
more and more, I think I need, these, to learn these games as well.
Well, you're doing paddle today, so why don't you master that
Yeah,
first?
but that's different. That's hand-eye coordination. I'm trying to be very balanced, you see, Prof. Tan, as I grow older.
It's a good thing.
So playing golf, paddle, a little bit of gym work, and then now I want to focus on strengthening
Cognitive.
the brain
Okay.
as well. Okay, because these guys drive me crazy every day. Okay, going back on here, one last time. Now, Prof, I want to ask you this, right? I mentioned just now on the Big Show TV about hand-eye coordination. How important is that to a patient or to people in general?
I mean, it's important because that helps with your daily function, right? Well, you don't have to have very high level hand-eye coordination like, say, athletes, but for even daily activities, you do need some hand-eye coordination.
I actually have a question. the executive functioning, because many of them, especially for MS, they complain about the memory, losing their memory, losing focus, losing attention, and all these would be essential if they want to continue to work or even to cook, perhaps, right?
Yeah.
So how how does NNI, help, or do you have exercises for that?
Well, so what you mentioned is some of the symptoms that they all contribute to what we would term cognitive function.
Yep.
I think cognition is a complex term, right? There are multiple aspects to it. It's not just about your memory, about being forgetful, but if you have difficulty focusing, so that might be termed as concentration problem, or in some people use the term brain fog as a layman's term. That can affect your day-to-day activities.
Right.
So MS patients do experience that as well. I don't think there's a simple solution, like a pill that we can give. I think it's multiple aspects. Being living a healthy lifestyle is helpful. Being physically active, right? Because physical activities can help with your cognitive and mental function as well. So we encourage our patients to exercise.
Amazing.
Okay. Why is it more? Many women, can't seem to catch a ball. I mean, this is just my observation. Like, for example, if I take a ball and I throw it at Angel, she won't be able to catch the ball.
We don't know.
In the past, all my girlfriends do the same thing. It's like I throw the ball, sometimes it's like they cannot catch it.
So I think.
So I realized that
yeah.
I think many women cannot, is it? Do you agree, Jerry? Are you good? If I throw a ball at you, can you catch the ball?
No, I'm no good, but I'm just very amused at FD's, shock and horror that is written on his face.
I tell you what, Prof. Tan, we're gonna send Glenn your way after 10 o'clock today, and then you can run some tests on him and see where he falls.
The first thing I want him to do is that test with the nurses, please.
Oh, what test with the
What
nurses?
test with the nurses?
I want to find out what conditions he has other than not being able to catch him.
Oh my goodness.
Okay, anyway, thank you so much. It's been a pleasure meeting and talking to you, Professor Tan.
Thanks for having me.
And Jerry, any last words?
Yes, I have a quote. So Martin Luther King Jr. says, we must accept finite disappointment, but never lose infinite hope.
Oh, okay. Thank you so much, Jerry. As always,
Thank
I'll
you for
see you
having us.
next week. Thank you.